barriers are not known, so people tend to be very conservative. And speaking in a university setting, we're also quite conservative. When we see resistance, we think of it as, oh, we should step back. But your view of resistance is that it's giving you some other kind of signal. If you could, you spoke about that a little bit.
Yeah, I think when you're doing health equity work, that recognizes a path to racial equity, and one in which we know that the structures have been designed against racial and class groups, you recognize that any progress away from that status quo is going to elicit resistance. If it didn't, you weren't making the change that you wanted to see. And so we view resistance as a part of the process, not something that is inherently a problem to shy away from, but rather an indicator that we are making incremental change for the better. And a sense of where there is a necessity to invest more deeply in not just the sort of programs or even the policies, but in the narrative around who is deserving, what is possible, and what is quintessentially American. And so that resistance is not something that I view as inherently problematic. It's, of course, it pops up and you have to work around it. You have to assess it. You have to understand what the opposition is and where it's coming from, and where there might be a source of agreement that can be made. But overall, if you're not having some resistance, then you're not leaning into the work and the complexity of the work hard enough.
So you're tackling huge systems that you're very familiar with from your work in the government, where you got major things done. And compared to the government, obviously, even an institution as large as RWJF is relatively small, and you're making these very large, long-term commitments that is going against the model of 2-3 year cycles, where if you don't show some positive feedback, then you move on to something else. Other than kind of resistance more generally, what other indications do you look that you're making good progress when you have such a long-term vision, where you're trying to move some of those very, very large systems that where the government is so big?
Yeah. So I think philanthropy is at its best when it works outside of its silos. And one of the ways that we try to do that is by partnering with other funders and philanthropic institutions and in the nonprofit sector at large, to seed sort of common vision, to think strategically across our areas of interest, and find ways that we can work together to achieve our goals, our shared goals. I mean, to your point, what we're doing is not something that's going to be accomplished in 2 or 3 years. At RWJF, we call them our generational goals. These are areas where we feel like we can make meaningful progress within a generation, but it doesn't mean that within that generation, every American is going to be covered and everybody's going to have affordable healthcare, but that we're making the progress and the steps towards getting there. We look at some indicators of change in the policy department and at RWJF to figure out whether or not the strategies that we're deploying are making a difference. So, for example, I talked earlier about our investments in what we call policy infrastructure, which is it's not a new phenomenon. It's something that's been written about. It's something that other funders have also invested in and used as a strategy. And one of the hypotheses behind funding the work in which we do in a networked kind of way and really forming trusting relationships with these organizations that are doing the work on the ground is an appreciation for creating the ability to make that short-term change, but also seeing that there are coalition tables and partners who are not talking to each other, who hadn't been talking to each other before, who are now sitting on tables together, who are strategizing together, who are thinking long-term together, who are realizing where their place is in the ecosystem and what else can be picked up by somebody else. And when we're seeing some of these small changes happening within the organization's ecosystem in which they're working, in which we're a part of that ecosystem, that gives us an indication that things are moving in the right direction. Another indication is that we look at the narrative. How are things being reported in the media? How are government officials talking about areas of health equity? What language are they using? Is there still a undergirding mindset that if we invest in this thing, then we need to take away from this thing? If this person is thriving, then this person has to be unwell in order for that to happen. Those sorts of narratives, we know those mindsets are undergird the kind of policies that have gotten us into many of the situations we are seeing today. And so we look for changes in that. Do we see policymakers speaking from an area of abundance where they understand that it's not as black and white as we invest in this and this person therefore gets nothing, that there are ways in which everybody can thrive in America when we have the investments that are and the programs that are really targeted and designed to remedy some of the harms that happened in the past. Everybody thrives. So these are some of the indicators that we're able to use to see, are we moving in the right direction? Are our strategies, are they evolving? The other thing that I think is really important is we have the privilege in philanthropy to be learners, to experiment with different ways of doing work, or different ways of strategizing. And we have the privilege of time to reflect on what is working and what is not working, and to evolve the way in which we work to reflect that. There are all different sorts of terms for that in the research and evaluation space. But for us, it's an evolved way of learning. And that means that we are listening to those that are most affected by the kinds of policies that we are trying to address, that we are making space for voices that are typically not engaged in policymaking conversations, that we're taking the time as a funder to really build a trusting relationship with community-based organizations or networks of community-based organizations, so that we can be equal partners in solving the problem together. And that's a challenge, and it's hard. And I encourage everyone to lean into that.
Yeah, that certainly comes across even the way you talk about not grantees, but grantee partners and the inclusivity that you have there. And I see your foundation as being a leader in kind of the trust-based community engaged module of grant making. And yet the history of your foundation is one of deep expertise, not only on policy and community policy, but just the expertise one needs to be able to deliver excellent healthcare. So how do you navigate, modulate that, still that there's a lot of expertise and then the community listening? Maybe we saw this during the pandemic where, kind of public health pronouncements became so heatedly misrepresented from a variety of different, and there's no time to be patient and thoughtful, maybe, but maybe not. But how do you modulate between that kind of expert knowledge that you have and then listening to the community?
We're learning as we're doing. And I'm very proud of the work we have done and continue to do at RWJF. There are other philanthropies that have been doing this trust-based philanthropy work for far longer than we have. And so we also learn from them as well. It is a culture shift and a practice shift has been for RWJF. Most of philanthropy has entered into this work. Our genesis was to come in and save, come in and throw money, come in with our own understanding of what the right answer is and impose that solution on the communities that we were most interested in serving, those that were typically disinvested in. RWJF, over a period of several years now, has evolved its thinking around health and health equity to be most explicit about addressing structural racism. And inherent in doing that and putting that thinking into practice is that we have to evaluate our own internal way that we have worked historically, learn from it, reconcile with it. And what we are hearing from our partners, those who talked about risk earlier, those who are or pushback earlier, those who are getting the most violent, often life-altering risk and pushback, are telling us philanthropy in that way does not work. We want to be equal partners with you. We want to think about what strategies will best serve not only our community, but all communities that are like us. And I think inherent in being focused on structural racism is a shift in practice and acknowledgement that the best solutions are coming from those who are most impacted. Because they can design so that they don't feel that, but that also nobody else feels what they have had to go through. And while we have over time at RWJF hired different staff who bring different types of life experience into the work, which I also think is really important. It is a combination of both our staff and their learned expertise combined with the expertise of the learned of the communities that we're trying to serve that I think makes our work better.
It strikes me how open you are to learning from your partners and grantees that things have not worked in the past. That seems to be an important piece of the learning journey that you have told us a little bit about. So it does seem that that there's a lot more change happening as we listen to you than one might think of, having known the foundation maybe 4, 5, 6 years ago. It's fascinating. Well, let's turn to Diane to begin our discussion and ask you, Diane, just to reflect on your experience at the intersection of philanthropy and policy in light of what Dr. Joseph has shared with us.
Sure, thank you so much. One of the things that came to mind as you were speaking about the long view is my experience when you're talking to a mayor with a 3-year term or a senator with a 6-year term. It's hard to get their interest in something that will take longer than their term to accomplish. Have you had to moderate, you think, your long view in circumstances where you're dealing with elected officials because of that?
So Yes and no.
Mm.
So I think from a vision and purpose perspective, we don't moderate the view of what we want to see ultimately. But I think as a part of our government affairs practice and even our media relation practice, tactically, we have to think about what's accomplishable in a short period of time. And often I get this question of, you really want to see this big change in the world that's going to take multiple systems and lots of people working as big, as audacious. And yet we have a bill that's hitting, the ground next week. Which one are you going to do? And I reject that because I think you can do both. And in fact, many of our partners, our community organizations have been doing both for years. And in some ways they nest in each other. We can have a vision for all being covered by Medicaid, for example. And in the short term, we can work in Indiana, where we know that there is a receptive legislative session, or in Oklahoma, where we can put it on the ballot measure and bring it to vote and educate the people on the benefits of Medicaid and make those incremental changes along the way. And then once Medicaid is in place, how do we expand the services and the providers and work in that way to get to the ultimate vision? So yes and no. I mean, I think we think practically about what is doable. For example, we have a generational goal around economic well-being for children and families, which is from a long-term perspective, focused on getting every family the resources that they need to thrive. In the short term, we have a tax bill that we know, regardless of what the presidential election is going to be, that will be debated next year. And within that tax bill, there are policies such as a child tax credit or the earned income tax credit or child care credits that can be improved. And can be improved so that those with the least resources are able to access them and alleviate their economic stress and improve the life of millions of people as a result. And that might be considered a short-term win, but we see it as a stepping stone and an opportunity that we have to take advantage of in the short term as we work on the transformational change of creating a tax code that serves the majority of Americans.
Where I live in Alaska, the second biggest foundation to the one that I ran is called the Matsu Health Foundation. And they're a scrappy foundation that were formed out of a sale of the community hospital. They've been a leader in DEI work in the state. What has happened now is they've become the target of a blogger who has a big audience in that area. The Matsu Valley is the area where Sarah Palin comes from. So it's north of where I live, but it's the fastest growing area and the most conservative area of the state. Their work in making some changes and some community activities ended up with community council members being thrown out of office and state legislators getting involved and so on. Key to all of it has been social media. So the existence of social media has made it that much more complicated. And also it causes the resistance to appear to be probably far more than it actually is. And I wonder if you or if you, Dean Pasic, have noticed, or are you aware of situations where the rise in social media and the existence has made this public policy work a little more challenging at times? It's controversial issues.
Yes, I think it, as you say, it ups the rancor of what used to be fairly civilized debates on the merits, and brings it into a different sort of cultural war space that feels untouchable by many. I like to remember that it is typically a small group of opposition that make a lot of noise. And the Matsui group Foundation has been so great at working through that and still being a real leader on DEI work. We also see social media, many people will say it's the great equalizer. I don't believe that. But we do see it as an opportunity to educate and share data and resources in a way that couldn't get it out as quickly before. And so there are ways that we counter some of the rancor that is in the social media space. And I think, listen, some of it is just that, right? It's just there to tantalize, and you can't engage with it all. But yeah, I think every organization, philanthropy or not, is sort of dealing with how to respond to the ether of noise that exists.
No, I have no expertise on that. I was just thinking about all the vaccine disinformation and all the kind of the things that shouldn't be viral that end up being viral, that make public health communication just so much more complicated than it must have been in the good old days, right?
I think one of the things we've at RWJF and in the public health sphere at large is doing a lot of work, not just on what the messages are, but who the messengers are, and really cultivating messengers who can connect with community and who are respected and speak in the language of community. And some of the most successful efforts to counter the vaccine misinformation and disinformation that was happening in the social media sector happened because of those trusted messengers, because of the church groups and the pastors and the local nurses and the community health centers who were able to have conversations at a real level and engage in the questions that were raised for many when they saw some of that disinformation in the social sphere.
Could you maybe share with us a story of your experience? I know you haven't been at RWJ that long, but often it's hard to measure your successes when you're in it for the long term. Is there a story you can tell us about something that's occurred as a result of the work that Robert Wood Johnson has done in the policy area?
Yeah, there are some good news stories, I think, and there's some lessons to be learned too. I think for a long time we have worked on coverage issues, and in particular on Medicaid expansion. But it was really probably in the last 6 or 7 years that we made a concerted effort in investing data and research, advocacy, particularly on the expansion issue and not just on Medicaid at large. We're coming up on the 60th anniversary of Medicaid, and the last 10 years have really been the most consequential in terms of states that have adopted Medicaid expansion, Medicaid being extended postpartum up to a year in many states making coverage changes for children that make more be covered, more children who are able to access coverage. And I think all of those are not attributable to RWJF, of course, but are successes in the fact that this is the fruit of a long, many decade fight of lots of organizations, RWJF just being one of them. I think another example of one that was a long-term investment for RWJF was our work on tobacco control. This was a almost 25-year investment in anti-smoking laws, in public education around smoking, that resulted in smoking restrictions, smoking bans, and has saved countless, well, not countless because we counted it, millions of lives, tens of millions of lives from smoking-related deaths. And yet, the industry has evolved, and there are now vaping and other electronic smoking devices, particularly those who still are able to market menthol, that are opening the door of it for a new generation of smokers. And so, or vapors in this case. So while we've had some success in that work that was long fought and which generated a lot of opposition, and one which we invested a great amount of time and resources in, it's also an example of how quickly things can devolve when you take your foot off the gas. I also am like sort of thinking about the evolution of RWJF and some of the ways in which we have learned lessons from communities and have changed some of our practices as a result. I think about our work around reproductive justice in particular. As a healthcare foundation, for decades, we did not do policy work around abortion because it was considered too politically divisive. And that means that the work that we did around reproductive health often carved out organizations that were working on reproductive justice as a whole framework, which included abortion care. And it, I think, said something for a large health foundation to exclude abortion as healthcare. It created divides and competition in organizations that were looking for resources. I think it was damaging to the credibility of RWJF as a healthcare funder. And it is something that we, especially post Dobbs decision, which I don't think I need to explain in this room, but is the Supreme Court rejecting Roe versus Wade protections, constitutional protections, has necessitated us to really look at that history of how we approach the issue of abortion and segmented it out of our economic justice work, segmented it out of our family health work, and to listen to organizations, particularly organizations that have been led by women of color, and in the South, who have coined now the movement around reproductive justice, and invest in those organizations and in this work in a very holistic way. And by reflecting on the lessons learned, on the way in which we were perceived by our grantees, by our partners, by others in the nonprofit sector, and engaging in a different way intentionally now, we are trying to do some of that healing and transformational work in our internal processes and not just the external programming that we do. A few stories.
That's terrific. Before we turn to the audience, let me ask you one question that's more on the personal side. And we have students here, but also online, who may be listening to your inspirational story of the foundation and your leadership at it, and may want to figure out how they too can contribute to this cause. How can they become a philanthropy leader who contributes to better health outcomes? What advice would you have in terms of for people who are eager to be a leader and to make a contribution in the philanthropic world?
That's so exciting.
Yeah.
I think there's so much possibility. I would say it's hard work and it takes courage. I think those who can come with courageous ideas and courageous actions can only help the field in the long run. I'm so energized by the young people who are coming into philanthropy, who are really challenging the field to assume responsibility for our own role in the adverse systems that we're trying to change. And so I guess advice would be seek out a value-aligned organization and bring your energy and courage to this work, and humility.
I love a combination of courage and humility. I like that. That's wonderful. Questions from the folks in the room? I don't know if we have the capacity to see any questions online.
I do have one online.
You have one online. Okay, well, let's give the folks who are here in person priority.
So I really liked, you're sharing the lessons learned from kind of looking back over how, the organization didn't want to address reproductive rights and particularly abortion, and kind of seeing the impact of that in the long term. And I'm curious because I feel like we see this particularly among the transgender community, and talking about diversity, equity, inclusion. Trans women of color and also trans men of color are some of the most oppressed folks when it comes to experiencing healthcare. So I'm wondering if there has been any considerations within that, particularly as you're doing like advocacy work and speaking out on how might you learn from that, or kind of share with us like what can we learn from that within this, because the trans community has been saying for a long time that this is a wedge issue that is not about trans people, but it's generally about oppression, which will also impact women as a whole.
Maybe we could repeat the question just generally, whether the experience around exploring focus on reproductive rights leads to any thoughts about transgender people and healthcare outcomes for them as well.
Yes. Yes. The answer is the big answer is yes. And how? So in RWJF's work around structural racism, we see we look at it from an intersectional lens. So it's not just structural racism, it's the ways in which ableism show up. It's the way in which gender discrimination show up, all LGBTQI shows up. And one of the things that we have learned in our journey of transformation, and I intentionally call it a journey because it's a long process, and one where we're learning and doing simultaneously. But one of the things that we have learned is when we looked at our grantees and the organizations that we were primarily funding, the vast majority of them for a long time were white male-led organizations. And while this is not something that happened overnight, it was a period of time for us. One of the ways in which we've changed our practices as we have focused more on structural racism is to look at organizations that are led by not only people of color, but organizations that are led by and serve those who are marginalized from a gender perspective, those who are marginalized from a disability perspective, those who are marginalized from a geographic perspective. And seed investments in those organizations create space for those organizations in coalitions that have been existing. Amplify where we can the messages from those organizations. And that has been a real intentional shift for us. I won't say that we're complete in that shift or that we've done it all right. But we have learned by doing. I'm often so encouraged really by the creativity that comes into problem solving when you're able to get diverse viewpoints on the table. And so that's the sort of work that we're continuing to lead into. I think it's also important when we're talking about, we've talked about policy change, we talked a lot about funding. It's not just, we at RWJF often will not refer to ourselves as just a grant maker, because that's not what we do in its totality. We see ourselves as strategic partners. We are often in rooms that the organizations that we fund don't even know exist. We see one of the tools that we can use is our voice as an institution to not only amplify those from organizations or from communities that have been disinvested in or marginalized, but actually to create the space for them to say, you want to hear from RWJF on this issue. Let me point you to this Southern Black queer-led reproductive justice organization who can tell you far more about how doulas can be integrated into care and improve health outcomes for those who are Black or Hispanic in this country than I could. And creating those avenues for different perspectives and solutions to be heard is one of the superpowers I think we have in philanthropy.
I could say, having funded the creation of a medical practice specifically focused on transgender patients, even though there was some news coverage, very little noise around that. It seems to really focus more on which bathroom you use and sports, where you get a lot of pushback, but I didn't really see very much around it, mainly because I'm guessing because people don't see that it affects them that much. I don't know, but that's my experience anyway. It's a great question.
Mr. Zevi, you had a question?
Number, but I'm curious if you could say, first of all, thank you for sharing those stories of lessons learned and successes and strategic partnership. I'm wondering if you can say a little bit about language and narrative, and give us, perhaps help us think about what language and narratives are working to advance health equity as a focus, right? This expansive notion of health that you all embrace, right? Economic justice, in addition to forms of health. So language that you find working well in whatever space it is, and then language we should be aware of that's really dangerous. And I think about the way in which the effects of the Dobbs decision are being covered over, or we're getting information out of quote unquote think tanks that's actually not real, right? So some language that we can use to help spread your message, and then some language that we should be aware of because it's misleading or dangerous.
What a great question. And do I have binders and binders of work that I can point you to? I will land on this. We and others have done a significant amount of messaging research around structural racism. We are in we can't deny that we are in a country that just the mere word race elicits emotional responses. And we are a country who has not dealt with the legacy of racism and ongoing racism. And there is a personal attack aspect that comes from the word. And so we were really intentional in the studies and the work that we did around, do we actually call it structural racism? Do we call it something else? Like how do we do this work and not shut off a conversation? First of all, we think it's incredibly important to name it. So that's number one, because it's a part of the repair work that we have to do as a nation. But entering into the conversation, we have learned to start with the value. Because at the end of the day, everyone wants to live in a healthier nation. Everyone wants to be able to give birth in an environment that is healthy and competent and that you don't risk losing your life. Everybody wants to bring home their newborn healthy. And when you start from the values, explain, because for many in this country, as we've had this whole conversation about RWJF and its focus on communities of color in particular, and communities that have been disinvested and marginalized. But for a lot of the people in this country, particularly decision makers, they have no interaction with that. They have not felt that in their lives. And so it's really important to describe how those barriers show up for people. So you start with the values, you explain how there are barriers that exist, that those barriers have been both unintentionally and intentionally designed. I think a really important message is that the good news is that people design them, and therefore people can redesign them, and that there's a role for everyone in that redesign, whether it is the sharing of a story, or the accumulation of the data, or the dissemination of the information, or the actual advocacy, or the lawmaking, or the policy making, or the writing, or the technical assistance, or the media pieces, or the brand usage. There is a role for everyone to remove those barriers, and we are capable of redesigning it. And I think that's a really important message. And that solutions exist. Like for a lot of these things, this is not rocket science. Like there are people who have done this work in their neighborhoods, in their churches. They see what works, and there are things that are scalable. And there are lessons to be learned from those things if we are willing to hear them. And so I think from a messaging perspective, it is lead with values and end with what's capable.
Well, on those words of wisdom, let me remind you that you've just been part of a wonderful conversation from one of our kind of leading change-making foundations, supported by our senior fellow in a wonderful discussion about philanthropy and policy. And please join us. I think it's on our website, definitely. Our next guest will be Lisa Hamilton from the Annie E. Casey Foundation. But please join me in a round of applause and thanks to Dr. Avenel Joseph and Diane Kaplan. Thank you. We are concluded.
That went off or something?
I was looking at the clock. We started 10 minutes late, and so I wanted, being aware of time.